A day I give the best of me. I'm only one, but not alone. My finest day is yet unknown.
Hello and welcome. My name is Ethel Lover, and today we're going to be talking about alternative medicine to cancer. And my guest is Dr. Albert Sanchez. Earlier we had his son on and we talked about cancer. And we wanted to go further into it because cancer seems to be outraged now. So many people are getting cancer. And maybe today we can give you some answers that will help you or maybe help your family or your friends. So I'd like to welcome Dr. Albert Sanchez. Hi, Dr. Sanchez.
How are you? And thank you for having me on your program.
Oh, you're welcome. Dr. Sanchez, what is cancer and who gets cancer?
Well, cancer is probably the most feared disease that anybody can get. And the reason that today it's not epidemic, it's pandemic, because we have 1 out of 3 women that gets cancer in a lifetime and 1 out of every 2 men that get cancer in a lifetime. So it's a problem that has to be addressed. And if you notice in the last 2 days, because of the turmoil with Ted Kennedy, all of a sudden the big media centers and the big media conglomerates are saying we have to pay more attention to cancer, and they're saying they will.
Now, what are some of the causes of cancer?
Well, probably the greatest cause, a lot of people say there are a few that cancers like colon that are hereditary, and a couple of breasts that might be hereditary, but the greatest majority of them are because of the environment that we live in.
Mm-hmm. Okay, I know that there are treatments for cancer, chemotherapy, and radiation. Now, what's the difference in chemotherapy and the radiation?
Well, the 3 modes of cancer that are sanctioned in the United States are chemotherapy, which is a chemical given to you to try to combat cancer. And this is where we've gone terribly wrong, because it's a toxin trying to take care of another toxin, and that's a toxic disease. The other is radiation, and the third one is surgery. And for a long time, doctors that veered out of the box of those 3 modalities were subject to be arrested because they were trying other modalities when all these 3 had failed. And today there seems to be a more lenient effort in everybody's part to see that whatever might work would be the treatment of choice for cancer patients.
Now, some people get cancer, and right away the doctor tells them that they have to have surgery or they'll die. And they panic, and they don't realize that the next day they're not going to die. It doesn't give people a chance to even think, and people just get stressed out about it.
Well, if it's surgery or radiation or chemotherapy, and we might add the word prayer in there, because that's all that the options that the cancer patient has. In the last few years, alternative medicine has become a different mode of cancer treatment. For example, this year, $3 billion will be spent by Americans to go to India to get Ayurvedic treatments for cancer. That was unheard of. Mm-hmm. But for years and years, cancer patients have been going to Mexico, and they have been going to Greece, and all the islands surrounding the United States have doctors that have fled to the islands so that they could practice alternative cancer and not be subjugated to jail. And that's one of the things that has to change in our country.
Now, sometimes, okay, people are taking treatments and they say they're in stage 4 or stage 5, and there's no hope for them, so the doctors give up on that. How true is that?
Well, stage 4 is the stage where cancer patients that are ill are told by their oncologist or their doctor, there's nothing more that we can do for you. You have only a few days or a few weeks or a few months to live. Go home. Get your affairs in order. And this is one of the great fallacies of today's treatments, because most patients will die within the time frame that their doctors have given them, because every day they expect to have only a few days more left in their life, and they will comply with the death sentence that they've been given by their doctor.
And that's where prayer comes in, because if you believe you're going to die, I mean, they panic. People are so afraid, oh, I'm going to die. I mean, they have it in their mind. I think when you have it in your mind, you'll die quicker. But this is where prayer comes in, and prayer gives you strength.
Well, everything in life is based on hope.
Yeah.
And if the hope is given up in terms of your disease, then you have no choice but to die.
Right.
And that's not the way it should be.
Now, is there alternative medicine maybe to take along with chemotherapy or radiation, cures, any other cancer?
You used the word
product?
Cure, and if we were to use the word cure, we would be subjected to jail sentences.
Right.
And that is totally wrong. So one of the things of the alternative medicine that we have had, and people ask me, in your search and all your research that you have done for cancer, what is the best thing that you have come up with? And I have to be very honest and say, Dr. Merle Garnett's brain. Because with his brain, without his brain, we would have never come up with the alternative therapy that we have for cancer, and that's poly-MVA. He's the discoverer. He's the person that put it together, and it is his genius that makes it possible for many doctors today to use something else that would help people. And remember, the doctors can't say that they cured anybody, but one of the things that we have come to an agreement with the FDA is that we have the ability to use the word reversed, that cancers have been reversed. Mm-hmm. And that's what